Second important diet is DASH diet. It's initially started with the aim of controlling hypertension better. So the sodium salt limit to 2.3 grams is most important recommendation in this diet, but there are other factors like what type of ingredient it should have, like whole grains, vegetables, fruits, fats, oils. All these things are prescribed on a daily and weekly basis. There is enough evidence to say that DASH diet reduces systolic blood pressure by about 5 to 6 millimeters and diastolic by about 3 millimeters, and also LDL is reduced by about 11 milligrams. There is imaging studies also showing that there is some reduction in the plaque. If you compare DASH diet and Mediterranean diet, there is not much difference except the amount of fruits or whole grains are slightly different, and there is particularly mention about olive oil in one diet, whereas it's not specifically mentioned in DASH diet, and sodium limit is given in DASH diet. Then third one, which is evidence-based, is healthy plant-based diet. This may be of more relevance for pure vegetarians in India, especially in South India, where they have prescribed purely not even eggs. So pure vegetarians also can have heart healthy diet, but the limitations may be some vitamin deficiencies and other mineral deficiencies may be associated with it. The mechanism is that there is low energy density, there is delayed gastric emptying with moderate insulinemic and glycemic response, and there is improved lipid profile in some studies when they are on this healthy plant diet. It is not that all the pure plant diets are healthy. If you are taking high refined grains, lot of potatoes or its products, or condensed juices and lot of sweets, though they are plant based, still they are as bad as animal foods. So probably it is for our daily practice, we should take an average of these three recommendations and see the patient's preference and his background, then give a practical diet plan to the patient. That is more important. Then Nordic diet is actually traditionally practiced in Denmark, Finland and Iceland, but the important thing here is what you should avoid. They actually listed red wine, sweets, fizzy drinks and food adhesives and highly frozen foods and fish, tinned fish, and these are the things they have advised not to take. Then there is another diet recommendation, that is TLC diet. This is mostly secondary prevention. Some prescriptions are there, not much different from what is already known. Then there is a flexitarian diet. Those who are purely meat eaters, for them they have divided into two stages, like beginners, advanced and expert. Meat should be avoided on 2 days, then 4 days, then 6 days, like that. In stepwise they can do and substitute what is already in their regular diet. Then somewhat popular and controversial is ketogenic diet. It is not totally unscientific, because as early as 1920 this was designed to treat epilepsy. So it had some good effect on the neurological patients, and the main principle in this is total carbohydrate is as less as 50 grams per day. Sometimes it may be even as less as 20 grams per day. That means the energy received is mainly from the fat that the patient takes. So fat will take care of the energy requirements. There is very little carbohydrate and a moderate amount of protein. The protein is moderate, about 75 grams, enough to preserve the lean body mass, but a little very early ketosis may be induced. That is the principle of this ketogenic diet. The mechanism is that one is the patient will feel less hungry, he will feel appetite is slightly reduced, hunger reducing role of the ketone bodies, then increased calorie expenditure. So there is promotion of fat loss. That means energy is derived from the body fat itself. But there are side effects, both short term and long term, like there can be long term problems of osteoporosis, gout and all. And ketogenic diet, the reduction of LDL maybe it is a bit controversial. Sometimes it shows positive, some studies have shown it's not very significant. And even total cholesterol and non-HDL may increase, in fact. Then there is another diet pattern which is recommended is intermittent fasting. In intermittent fasting there are two types. One is alternate day fasting, another is time restricted eating. In alternate day fasting was no different from controlled calorie intake of conventional advice. This was found in the various studies. But time restricted eating, that means if you are asked to take only during particular hours, suppose you keep 9 a.m. to 5 p.m. only you take food, rest of the day time don't take except some fluids. If that is the advice, that is time controlled eating, that may have significant weight loss and improvement in the metabolic health parameters. Probably this is a traditional practice. In the villages, if you see, people don't eat after sunset and they start eating only after with sunrise. So this may be a traditional practice which may be having similar background. Then what is coming up is heart-gut axis. They have found that there is an important correlation between gut health and heart health. The diagram here, you can see that on the left we have got animal proteins and animal fats, which actually increase the dysbiosis, increase the atherogenic principles in the body, increased platelet aggregation, atherosclerosis is induced, inflammation will increase and blood pressure will increase. Whereas prebiotics and vegetarian diet or heart healthy foods will actually have opposite effects.